All right, guys, hopping right in the way I like to. I think there's a real need to discuss kind of the expectation versus reality in the world of pain management and or like injuries in general. So it's joint injury, spinal injury, injury, muscle tear, muscle pull, ankle sprain, we got Luka Doncic with the calf injury, those types of things. We, will say things, or I hear a lot of people say like, I've done everything, but now this isn't working, or I've done everything and I need to do this, or, the other day we had somebody who was in my practice who has been in my practice for quite some time, and she hurt her back at work, and because I wasn't in on a Monday, she went to the emergency room. And, you could say that's my failure as an educator. We could say because this person in particular doesn't speak English, that it was a language barrier. We could say that she was just so scared because she hasn't been in that amount of pain before, she didn't know what to do. And honestly, I'll tell you as a provider, that breaks my heart because I think it's, quite simple. Like when your back hurts that bad, even though it's scary, but maybe you've had some amount of pain on that spectrum before, you ice, you rest, you find, take some Advil, you whatever, and you go, you get to the chiropractor, you go see your therapist, whatever. And unfortunately, that wasn't the case. They went to the hospital, they gave them meloxicam and a muscle relaxer and told them to go home. It's like unbelievable. She got about, 40, 50% better the day in the office, but that doesn't mean she's like 40%, better on the way back to, healing. And that's just it. People, this is not a message about healing takes time. Like that's too simple, right? That's too obvious as something that's going to be said. My message is more along the lines of understanding how significant these injuries are in your lifetime, whether you're 23 years old, whether you're 56 years old. What the injury looks like in terms of the ability to get over the injury and be more stable as a 23-year-old, if you do everything right, is much different than when you're 56 trying to get over the injury and doing everything right. In either circumstance, you have to do everything right. You have to go get physical therapy or chiropractic, manual therapy for these joint injuries. There's probably a protocol for almost everything. And then right away, if the provider is smart enough, they'll send you for imaging and advanced imaging to make sure that they can rule out other possibilities, and then you may or may not have to go to a specialist. Now, when you think of what a specialist is, understand when I'm saying that, I'm not the guy that's like, oh, you need to go see the knee specialist. You need to go see the heart specialist. You need to go see the brain specialist, whatever they may be. That is a actual that is a surgical consult. That doesn't mean you need surgery. It means you need to have a surgical consult and understand what your options are moving forward. Because I can promise you, any pill you're going to take is not a cure. The pill you are taking is to manage your disease. Just ask a type 1 diabetic what it's like taking insulin every day. You know what I mean? And that is, something that has been around, made from ourselves. I think they're actually called a biologic, if you will, to be able to sustain life. Now you put that on the sort of the injury spectrum from a calf strain. It may be 6 to 8 weeks. It may be less, it may be more. You may deal with that for a full season as an athlete going full strength to where you may not really recover until you rest it enough to where those fibers that are torn gristle, we call it gristling, Stu McGill, and then you begin to rehab past that with the phases of that I talked about yesterday in a podcast or an episode that I did on my channel, Dr. Pearlman TV channel right here on YouTube. We talked about the progressive motion, passive progressive motion. We talked about active progressive motion. We talked about active full weight-bearing motion, compression motion. Those are the phases to getting joint injuries rehabbed and better. It does not happen overnight. For people that want, to suppress their immune system, for people that want to suppress the way that like a pain, gateway happens, at an instant in time, whether it be through an adjustment from a chiropractor or whether it be through a pill to reduce inflammation, these pathways are working at an instant in time and you feel a little better. You're managing symptoms. Don't let anybody tell you that they have something better that like cures. Like it just doesn't work that way. Or do they have better advancements in science and medicine and, supplements and therapies now in the forms of certain, injectables, maybe. But I would say the efficacy and evidence on any of those is very, sketchy, or, small sample size to be sure. I mean, I certainly, in my practice, and I see hundreds and hundreds and hundreds and hundreds and hundreds and hundreds of people just as a solo practitioner throughout the year, I certainly I have not seen anyone with a stem cell or a PRP or a cortisone injection or any other type of, injectable, especially into their back injuries, let alone their knees or their elbows, be anything that has, been, permanent or past what could be perceived as placebo. And I hate even bringing up placebo, because even though there is a placebo effect in everything, there's probably more of a nocebo, or the negative expectation, or that cynical, it's not going to work. I'm a pessimist, so it's not going to work. Nocebo effect, where, oh my God, it actually worked. I feel a little better. Like, well, where's the placebo in that? No, it's not. It's why we say you got to feel it to heal it. And so what happens is, when it comes to something like shockwave therapy that I do in my clinic, I've seen tremendous, results with that in terms of management of symptoms long-term, or even for a short period, elimination of certain symptoms short-term. In terms of what long-term looks like, that's the point of this video. It's a long-term process of management of symptoms. And here's the thing, you have to be okay with that. And if you're in this video, if you're watching this video, when I say you have to be okay with that, I'm not saying this to try to brainwash you. I'm not saying this to say you have to change your thinking. You would have to change your thinking if you thought that I just want it once and it's going to go away. Like, I have a friend of mine, love her to death. She was having neck pain. She lives far away. She, had reasons not to be able to go to the chiropractor. And she said, I just don't want to do it. I can't do it. I'm sorry. I know you're trying to help. But her exact words were, I need something more permanent. And I feel terrible, because when that injury becomes bad enough, what she'll realize, sadly, or accept it, is that there is no more permanent. There is only the management of those things, unless, like we talked about, you see that specialist, you see the surgeon for a consult to see what type of limitation of matter needs to be taken out of the way. What does that matter that's limiting, that space being taken up in our beautiful, human body, the spinal cord and the nervous system, the pathway, brain to body, body back to brain, what may need to be done there? Because if the answer is nothing, or simply that's not going to happen, be ready to accept. Please be prepared to accept what managing symptoms looks like naturally. The beauty of chiropractic is that when it comes to pain. And you see, I'm going to end this video with saying, don't sit there if you're a chiropractor watching this video and go, we heal so many things, we can help so many things. Of course we can. Nobody believes more in subluxation complex than I do. Nobody believes in innate intelligence, more than I do. But I'm also a realist, and I don't sit there and exaggerate past certain things. I've seen amazing things. I've adjusted children and seeing some ridiculous things in their sleep habits and their colic, just reverse, boom. I have seen, children literally just from doing like a little Atlas rub. I have seen them fall asleep on the table and literally just zonk out. I have seen people come in non-baby related with terrible vertigo, and I've adjusted them once and their vertigo is gone, like just eradicated, and they've been suffering for months. How is it? Well, I know how it is. What am I going to do? So the point I'm making is, you've got to understand that all this health and all these symptoms and all these struggles and all these diseases are on a spectrum, and that a lot of times, especially when it comes to pain, it is management. I hope that helped today. I hope that's a good, realistic input that I hope you've taken input and empowerment and education from this video to understand more and accept more that that's what it is, and that is just the truth. And that is what we do here on this channel. So until next time, everybody, it's Dr. Pearlman.